The World Health Organization's World Malaria Day aims to raise awareness of one of the world's most deadly diseases. It infects about 250 million people per year, and it's the cause of 620,000 deaths. 95 of the cases are in Africa. And prevention continues to be the main way of avoiding being affected with malaria. Mosquito nets, repellents and anti-malaria medicines are key to the fight. Since at least the 17th century, humans have tried to treat the disease by using ground-up bark from the cinchona tree, scientists eventually extracting the key ingredients of quinine in 1820. And it wasn't until the end of the 19th century that it was the first proven that mosquitoes carried the disease. And over the next decades, a number of treatments and preventative medicines were identified, including chloroquine in 1934. In the 1980s, work began on a vaccine, a jab made by GlaxoSmithKline, was eventually endorsed by the World Health Organization in 2021. And that same year, China was declared malaria-free. But now, a new vaccine developed by Oxford University that can be produced in higher volumes has been approved by use in Ghana and Nigeria. And earlier I talked to Professor Katie Ewer from the Vaccine Immunology at Oxford University's Jenner Institute.
Well, it's a great achievement for us to be here today. It's been a very long road to having a very highly effective malaria vaccine. I've been working in malaria vaccines myself for 15 years. I've tested at least a dozen new vaccine candidates. None of them have worked until R21. So it's a massive achievement, not just for Oxford, but for everybody in the field who's been working towards this for so long.
So how difficult was it to have your vaccine approved in Ghana and Nigeria?
So we have been submitted data to the WHO and regulators for a little while now, pending approval of the vaccine for widespread use. So it's really up to independent regulators in those countries to decide if they're happy for the data. We don't really have that much involvement as scientists. You know, once it gets to that stage, we hand it over to them. But it's great news to see these vaccines being approved for the first time in Africa, where they're really needed, without waiting for WHO approval to go ahead with these vaccines.
So how long was the process, and how does the vaccine work exactly in layman's words?
So we've been developing R21 since 2015, and R21 works in the same way that all vaccines work. They train our immune system to recognise a virus, or in the case of malaria, a parasite, and to produce antibodies to fight that infection off. And what we know with malaria is that you need very high levels of antibody to get good levels of protection, much higher than we need for some other diseases, and that's why it's been so difficult to get to where we are today. So the vaccine has been approved for use in children aged 5 and 36 months, the age group at the highest risk of death from malaria. So what does it mean for the global fight against malaria? Well, it's huge. I mean, we already have some tools that are effective in combating malaria, so things like insecticide-treated bed nets, seasonal malaria chemoprophylaxis, where people take anti-malarial drugs before the malaria season. But we've never had a vaccine, and this will be an incredible, useful addition to the toolbox. And if we take Nigeria, for example, Nigeria is one of the countries globally worst affected by malaria. It has over a quarter of all cases of malaria every year. 60% of hospitalizations in Nigeria are related to malaria. 30% of childhood deaths in Nigeria are due to malaria. So it's a really great location to see this vaccine rolled out for the first time. And I'm really pleased that Nigeria are at the front of getting this vaccine deployed.
And with malaria and COVID vaccines now under the belt, which life-threatening diseases are you and your team working on?
Well, I mean, we've been working on making lots of different vaccines for a very long time, and I think before COVID, people were much less interested in our work than they are now, which is great. I think it's really good to see how much interest there is in vaccines now. So we've made this malaria vaccine against the most deadly form of malaria, which is called falciparum, and that's the one that's very common in sub-Saharan Africa. But there's another form of malaria called vivax malaria, which is very common in Asia. And although it doesn't cause as many deaths as falciparum malaria, it does have a massive economic and public health impact. So I think the next thing that we will be taking forward is hopefully a vaccine against vivax malaria.